Welcome back to Today's Health. In this segment, we're going to be talking about radiation therapy for breast cancer with radiation oncologist Dr. Matthew Johnson. Dr. Johnson, can you start by going over an explanation of what is radiation therapy?
Sure. So radiation is basically just the use of high-powered X-rays to treat the cancer. And the way they do that is we point the X-rays at a certain part of the body where we know the tumor is. And the X-rays damage the DNA of the tumor cells so that those tumor cells, they can't divide, they can't grow, and ultimately they die.
What are some common misperceptions about radiation therapy?
A couple of things that people worry about with radiation. One is they think that it's a painful treatment, but in actuality, getting a radiation therapy treatment is almost the same as getting a chest x-ray at the doctor's office. You don't see the radiation, you don't feel the radiation. Now there are potential side effects of radiation treatment, but those usually take a couple of weeks before they're noticed. But it is a non-invasive treatment, so it is not painful. And I think the other thing I would like to address is a lot of patients are worried that while they're getting this treatment, they're radioactive, that they can't be around family members or small children, or they can't, get on the airplane without setting off the alarms. I can tell you that when this treatment's delivered, as soon as the radiation treatment machine is turned off, there's no radioactivity in the room, so patients can go home and not have to worry about, that they're exposing anyone else to radiation.
That's great. Now, how is radiation therapy used to treat the breast cancer?
So in breast cancer specifically, radiation is usually used as an adjunct to surgery. So typically, the surgeon will remove the breast tumor first, and the radiation treatment's added on afterwards. And the main way that the radiation helps is by decreasing the risk of the cancer coming back in the breast or also in the lymph nodes nearby the breast that might be at risk.
Are there different types of radiation therapy?
So really there are two main types of radiation that are used for breast cancer specifically. Probably the most common is the external beam radiation treatment, and that's where the radiation is delivered using a linear accelerator, which is a machine that delivers radiation from outside of the body. So when the patients lie down on our treatment table, the radiation beam is pointed at a certain part of the body and delivered from outside the body in. Typically that kind of treatment involves the patients coming usually 5 days a week, Monday through Friday, and the courses typically can last anywhere from about 3 to 6.5 weeks of treatment.
What other types of therapy for radiation therapies are there?
So for breast cancer, another common type of radiation treatment is brachytherapy. Brachytherapy, instead of the radiation being delivered from outside of the breast, is where, with the help of the surgeon, our surgeons will place a small device inside of the breast that has a catheter sticking out. This allows us to put a tiny radioactive seed into the breast itself, and the radiation comes from the inside out. And we do have surgeons in our area that have done this procedure. Dr. Clark Paul, Dr. Bout have both done this procedure with us and are familiar with it. And usually the advantage of the brachytherapy is that for patients who qualify, and usually it is patients with earlier stage disease, the treatments can be done twice a day for 1 week, and the patients will be done after just 1 week of radiation.
Wow, that's awesome. So the brachytherapy is typically used for those in the early stages of being diagnosed.
That's correct. The brachytherapy only treats part of the breast, and so we really want to take patients, not patients who have had the cancer spread to the lymph nodes or very large tumors, typically are not good candidates.
So you talked about using that for early stage. Are there any other factors that you consider when trying to determine which type of radiation to use for breast cancer?
Absolutely. Some of the factors we look at are, the patient, what stage the breast cancer is. Like I said, if it's very early or more advanced. We look at a number of features under the microscope, like how aggressive it appears. We look at some aspects of the surgery, like if the surgeon removed the tumor and it was very close to the edge, or if it was kind of further away and the margins were widely negative. So it really is And it is a multidisciplinary decision, so it is something that the surgeon and the radiation oncologist generally talk about and have to agree to afterwards.
Now, what are the advantages of having this therapy done at the Karmanos Cancer Institute at McLaren Port Huron?
I think that's a good question. I think some of the big advantages are, one, we do have a good multidisciplinary practice here where we work closely with the medical oncologists and the surgeons to make sure patients have a good individualized plan of care. We offer a lot of support services as well, such as some patients will be seen by our dietitian, some need to be seen by our social worker for various issues. We also have a financial counselor that can help anyone that might be having some concerns about their bill for these kinds of treatments. We also have a brand new linear accelerator. It's only, a year old, and it really is top of the line technology. So we're giving treatments that are very safe, highly accurate. And I think another advantage that we offer is the AlignRT program, which basically what that is a way of making sure that patients who have left-sided breast cancer, that we keep their heart dose of radiation negligible. It's something of an area of research going on in radiation right now, but our belief is that sometimes even low doses to the heart can increase the risk of people getting cardiac disease down the line. So we use a technology called AlignRT that helps us to make sure that when we do our treatments that the patient's heart is out of the way and protected.
Wow, all of these benefits you listed, and in addition to that, it's close to home for those who live in our community.
Of course.
Doctor, this has been great information. Do you have any closing comments for our viewers?
I think one thing you'd asked me in our previous section about screening, and I'm sure that this seems like common sense to a lot of our viewers, but I really do stress people should get their screening done. Developing these kinds of cancers, that the best thing we can do is treat it earlier. When we have it earlier, diagnosis, it's easier to treat, it's easier to manage. And so certainly I think women should try and keep up on their screening, and certainly if they feel that there's something wrong, that they should seek the care of their primary doctor who can order the appropriate tests.
Doctor, that's great information. Thank you for joining us today.
Of course, thanks for having me.
Stay with us. We'll be back after this break.